Because the ear is responsible not only for hearing, but also balance and spatial orientation, even mild ear symptoms can significantly reduce quality of life. Around 80% of people experience ear-related problems at some point of their life. That's why I will explain the top causes of ear pain and ear problems and how they are managed and resolved. The first and most common cause is earwax accumulation. It causes ear canal blockage. It causes discomfort, fullness, and reversible hair loss in everyday life. Earwax, which is protective biological substance, is produced by oil glands and sweat glands in the ear canal. It traps dust, bacteria, and fungi, moisturizes the ear canal, and inhibits bacterial growth. So, it's normal and protective. Under normal condition, earwax moves outward naturally during jaw movements and chewing. When this natural migration fails, earwax is pushed inward and accumulates excessively. The most common reason is the use of cotton swabs, which push earwax deeper instead of removing it. Aging reduces the quality of earwax, and hearing aids, earbuds, and earplugs create mechanical blockage that prevents normal migration. This problem mainly affects adults, but it can occur in children. People say, my ear feels clogged. It feels the water stuck inside. There is no night pain, no fever, no general weakness. The symptoms are mild, mainly pressure-like, and often become worse after showering. The solution is not to use cotton swabs. First-line treatment is earwax softening using warm saline or mineral oil or diluted hydrogen peroxide or commercial earwax softeners. Usually it's effective within 3 to 5 days. In some cases, mechanical removal, curettage, or suction is used, and it is required, and it must be done by a clinician. The second most common cause of ear pain is otitis externa, meaning inflammation and infection of the outer ear canal. It is very common, especially in hot climates and during summer. Normally, ear canal is protected by earwax, but when this layer is washed out, its defensive function is lost and bacteria multiply. The most common pathogens are Pseudomonas aeruginosa and Staphylococcus aureus. This condition is common in swimmers, people living in hot and humid climates, children and people who frequently touch or clean the ear canal, especially with finger earbuds or objects. The pain worsens at night, increased when touching the ear, and may radiate to the jaw. Usually there is no fever, no general weakness. If fever is present, it suggests more severe infection. A key diagnostic feature is pain when the outer ear is touched or pulled. Treatment consists of topical antibiotic ear drops or ibuprofen or paracetamol for the pain. The prognosis is excellent in most cases. The third most common cause is otitis media. It is the infection or inflammation of the middle ear, and it's one of the most common bacterial infections in childhood, as well as one of the leading reasons for antibiotic prescription worldwide. Almost 90% of children experience at least one episode. In adults, it's less common, but still occurs. The infection develops behind the eardrum, where fluid accumulates with inflammation and infection. The middle ear is normally air-filled and ventilated by Eustachian tube, but ventilation often fails during common cold, influenza, or other viral infection, or other upper respiratory tract infection. It usually starts as a viral infection and may progress to bacterial infection. If it's caused by bacteria, most common pathogens are Streptococcus pneumonia, Haemophilus influenza, and Staphylococcus aureus. This condition causes deep ear pain, pressure, and fever. The pain is constant, throbbing or aching, and not affected by touching the ear. which distinguishes it from otitis externa. Fever and nausea and generalized unwellness are common. Pain often appears before fever and worsens at night. In some cases, eardrum ruptures, leading ear discharge and sudden pain relief. Treatment includes ibuprofen and paracetamol. Antibiotics, usually amoxicillin, are indicated in severe cases when there is high fever or young children. The prognosis is good. It improves within 2 to 3 days. Hearing loss may occur, but it's usually temporary. The first most common condition is Eustachian tube dysfunction. It causes air discomfort without infection, and it's especially common in adults. It occurs when Eustachian tube fails to open properly, causing pressure imbalance. It commonly follows viral upper respiratory infections, allergies, rhinitis, and sinusitis. People describe air fullness, pressure, or popping, or clicking, with temporary relief after swallowing or yawning. A key feature is hearing one's own voice or breathing loudly, which is alarming but benign. Symptom worsens with altitude changes, such as flying. Patient often says it feels like pressure, not pain. Treatment focuses on reducing nasal inflammation, yawning, swallowing, or gentle Valsalva manners. Saline nasal sprays and intranasal corticosteroids are effective, and antibiotics usually don't help. The prognosis is excellent also. The fifth most common cause is referred ear pain from the throat, tonsils, or sinuses. It's not ear pain. The ear appears completely normal, with no redness, no discharge, yet patient says it hurts when I swallow, or my throat pain goes to my ear. Pain feels deep, not external. Treatment targets the underlying cause, such as pharyngitis, tonsillitis, or sinusitis, along with analgesics and hydration. Prognosis is excellent in most cases. And sixth most common cause is temporomandibular joint disorder. Temporomandibular joint lies directly in front of the ear canal, and dysfunction can feel like ear pain. Patient says it hurts when I chew, or yawning make it worse. Morning stiffness suggests night clenching or grinding. Clicking or locking of the jaw is characteristic. Stress worsens symptoms. Hot and cold sensitivity may suggest dental problems, so we should exclude them also. Management focuses on addressing the underlying jaw or dental causes. The seventh most common cause is barotrauma. It is a pressure-related injury during flying, diving, or attitude change. Rapid pressure shifts cause stress on eardrum, leading to fullness or pressure sensation and temporary hearing loss. It usually resolves spontaneously, and prognosis is excellent. And eighth most common cause is otitis media with effusion. It means fluid in the middle ear without active inflammation. It is caused by chronic Eustachian tube dysfunction. Patients have persistent fullness and hearing loss without pain, lasting weeks to months, and no fever. Treatment is usually observation and management of nasal or sinus cases, and prognosis is good. And ninth important cause is sudden sensory neuronal hearing loss, which is medically emergency condition. A patient say I woke up deaf in one ear, or my ear suddenly went silent. There is usually no pain, but fullness or ringing sensation may be present. It requires urgent systemic corticosteroids and immediate treatment. The outcome fully depends on early treatment. That's why it's emergency condition, and we should exclude it first.